Welcome, everybody, to the Understanding Endometriosis webinar with Zia Relief and Matilda. So today we will be discussing living with endometriosis and how to manage its symptoms. My name is Jade. I have Jo with me from Matilda, but before I do the formal introductions, I would like to begin by acknowledging the traditional custodians of the land on which we are on today, the Wurundjeri people of the Kulin Nation. And I pay my respects to their elders past, present and emerging. I extend that respect to Aboriginal and Torres Strait Islander peoples here today. So as I mentioned, my name is Jade McKenzie, and I'm a director at Zia Relief. If you're not familiar with Zia Relief, we have created the very first range of natural remedies in the world to contain the unique therapeutic benefits of Kunzea oil. So Kunzea is a native plant in Australia, and it is the key active ingredient in our signature range of Zia Relief personal care products designed to relieve, protect, heal, and soothe. And the reason that we are putting on this webinar with Matilda today is because we are very community focused, and we are not the experts in health and different chronic conditions, but we really love to share great information with our community from people who are specialists in their areas and make sure that our community are getting really well-researched, balanced, and informed information. That's really, really important to us. So Jo, who you see in the beautiful pink checkers, is an MCLIN physio. I don't know if I said that right. MCLIN physio for continence and pelvic health. She's a physiotherapist and she works at Matilda Health. So Jo is a dedicated continence and women's health physiotherapist, and she's the co-founder of Matilda. Specializing endometriosis, pelvic pain, and sexual dysfunction, Jo built Matilda with Dr. Kevin to provide holistic care, symptom optimization, reducing time to optimal care, and minimizing costs for people with endometriosis. Jo is passionate about getting Matilda into the hands of people who need it, empowering them to live a better life. And for those who have come through Zia and don't know who Matilda is a digital health platform chasing the vision of improving the lives of the 190 million people living with endometriosis around the world using technology. So Matilda does this by offering affordable access to holistic care, and it was born in 2022. And it offers people the ability to track their symptoms and lifestyle habits to better understand their condition, learn from an interactive evidence-based resource library, attend live and on-demand classes with specialized holistic care clinicians, and access a community of endo warriors to support them on their journey. Welcome, Jo.
Great to be here. I'm excited to tell everyone a little bit about endo and Matilda and holistic care.
Yeah, and I'm so excited to have this discussion for you because it's one of those things where if you mention it to a girlfriend or somebody, they'll either go, "Oh, yes, I have experienced that," or "I know someone who has." And when we say 190 million people, but it's something that is not so openly and widely discussed, you could see that there's a real need for
Absolutely.
for these discussions. So tonight I'm going to be asking Jo some really hard-hitting questions. Not really.
Ready,
I'll be asking
ready.
her questions
Yeah.
about endometriosis that we think will be really informative and really help you on your journey, either as somebody who's experiencing it or somebody who's caring for somebody who has been diagnosed with it. And at the end, we'll open up to a couple of questions, but it's going to be an informal discussion and it's really led by what we we know is very common issues and questions that come up in this community. So I'm going to start at the very start, Jo. Let's get our basics.
Yeah,
What
good.
exactly is endometriosis, and how does it differ from other menstrual disorders and conditions?
Absolutely. So this is a question that I love because it's actually very important to understand the fundamental definition. And endometriosis often is confused with other things and it's often poorly explained. So, what endometriosis is defined as when tissue similar to the lining of the uterus is found in other parts of the body. Now, the problem is that the lining of the uterus is called the endometrium. So it is tissue similar, but it is actually not the same tissue. So that's quite a fundamental thing to understand so that that helps. Obviously, the right definition helps to get the treatment right and research right. And then how it's different to other conditions is it's actually a disease that's been found on every major organ in the body. So we don't even really call it a menstrual disease anymore, a reproductive disease or a pelvic disease, because the research has grown beyond that now. So it's been found in the nasal cavity, it's been found in the heart, on the lungs and the diaphragm. And so this tissue, while it is most commonly found within the pelvic region, it is sometimes found beyond that. And so now we are thinking of it like a whole body disease that involves multiple systems. So there is some involvement of the immune system. There's a reason these cells are not being, I suppose, cleared out as other cells that are dysfunctional would be. So there is an immune kind of dysregulation, there's an inflammatory system response. So it's different from other conditions like polycystic ovarian syndrome, like adenomyosis. So while these other conditions, they all have similar, I suppose, symptoms, they are fundamentally different diseases.
Wow. Okay, so I
Yeah.
didn't know that.
Yeah, it's quite,
Wow.
I think because one of the most common symptoms of endometriosis is pelvic pain, heavy and
Mm,
painful periods, infertility, bladder and bowel dysfunction, and they're all things that sit within the pelvis. But we also hear a lot about deep, all-encompassing fatigue. We get some people that have, problems in terms of shortness of breath with their lungs, if they've got problems with endo towards their diaphragm, or they've got pain up around their kind of rib cages, the pains down their legs. Yeah, there's all different kind of symptoms that can be a little bit weird to think of beyond the pelvis. But yeah, definitely a disease that is beyond the reproductive system.
wow. Okay, thank you. I know that was a very basic question, but actually that is critical
Yeah,
information because I do want to ask you what the most common symptoms are and how they typically manifest.
yeah,
And I mean, that's a great way to move into this question because I
yeah.
knew that it wasn't always so localized. I
Yeah.
didn't realize that it could be full body.
Yeah, it's definitely something that is sometimes discussed, I think, because it's not as common. So you'll hear some people talk about, particularly their diaphragm endometriosis,
Mhm.
or that kind of, we see it sitting on the other lining, so the inside of the peritoneal cavity where it borders the diaphragm. So definitely something I think it's most commonly found in the pelvis, but can extend beyond. And then to go back to kind of answering common symptoms. So I would say kind of the most common symptoms that are discussed are pelvic pain, infertility. So we know that up to 50% of people diagnosed with endometriosis will experience fertility challenges, bladder and bowel dysfunction, heavy painful periods, fatigue, bloating. So see lots of people talk about endobelly, which is
Mhm.
that really distended abdomen. We talk about the mental burden a lot. So, mental health challenges, brain fog, they would be your most common, and pain with sex. So, yeah,
Yeah.
dyspareunia, we call it scientifically. So, they would be your most common symptoms, and how they manifest is different in every endo story. So, I've treated in this field for a while, and obviously through Matilda, we've done lots of interviews and heard lots of stories. And something we hear a lot is, I was 12 years old and I got my first period and it was heavy and it was painful. I didn't know what was normal, because it's very hard to know what's normal when you're 12, yet let alone to do with menstrual health. 12's a hard age, even without having heavy and painful periods. And then it kind of goes on in this cycle of it might be pelvic pain that you're experiencing. You might not be able to use tampons, things like that, where you feel like that's painful. And then it might be things like significant bloating, or pain once you become sexually active. And it kind of develops like this. Some people will say that they don't experience symptoms till they're in their 20s. Some people have what we call silent endometriosis, where they have no symptoms, and it's not until they try for a baby and that then they have this symptom of infertility, where they find it difficult to fall pregnant despite having no abnormal symptoms prior to that.
Right. So it's a real mixed bag. Like, you don't
It's a
know.
real mixed bag. That's what I think is part of the parcel of why this story is so tricky and this disease is so tricky, is that it's a very, I suppose, wild disease, that it is the way it behaves, it's poorly understood. There's a lack of research into it. And then you've got the way it manifests in everyone is very different, that you can have stage 1, very mild endometriosis and have severe symptoms. And you can have stage 4, deep infiltrating endometriosis, which is very significant, and have no symptoms. So it's very, I suppose, bizarre in how it presents in different people. And I think it's poorly understood why that occurs still, which makes it very hard to treat and things like that.
Yeah. And coming back to the word normal, I mean, everybody's cycle is so different. And like you said, the symptoms present in a unique way in each individual. And I think as a woman with a menstrual cycle, you are moving through puberty into teens, into 20s, into exploring, like having children. Maybe you've had children, perimenopause, like at all of these stages, your normal looks so different.
Absolutely. And I think at 12, who's to say what's normal? Or we see some girls get their period at 10, even younger. Some are later bloomers, but it is 100% what's normal. So I think there is more education now going out about what's normal. So a normal period means you might experience some pain, but it should not interfere with your daily life. So you should still be able to go to school. You should still be able to exercise, and regular pain relief like Panadol should ease that. It shouldn't be something that you have to miss your daily activities because of. So that's kind of that now, the way that's being framed, of anything beyond that would be deemed abnormal. But absolutely, it's hard when things change in your life, which changes how your menstrual cycle is. So I think lots of the time with gynecologists, they talk about it of like a marrying of a few things. Like, is it that they have particularly painful periods? Is it that they have endobelly? But I would say the periods are probably the first distinguishing factor that most people will talk about in their teenage years, or as they go to university or throughout their 20s, that they notice that becoming more prominent.
Right. That makes sense as you're developing. Yeah. Okay. So
Yeah.
I've just opened up the poll because I did want to talk about how endometriosis is diagnosed and what tools they use to diagnose. And I thought, let's go to the About You poll. And 94% of people have said that, yes, they have had a diagnosis from their doctor, and that 69% have moderate symptoms, and actually 25% have severe, and light symptoms is only 6%.
Yeah.
So a lot of people who are listening live will have been through the diagnosis, but I would love to speak to you about that and ask, what is the process and what are the tools that they use?
Yeah, so diagnosis is still very complicated. So we know there's a diagnostic delay of anywhere between 6 to 8 years, which
What? Years?
and I wish I could tell you that was from onset of symptoms, but it's actually from care-seeking behavior. So it's actually from when they first go to a doctor. So it's not even when they might be 12 and wait till they're 18. They might be 12 and not go to a doctor till 15, and then they might wait 6 to 8 years on average. So that is here in Australia. So we live in a blessed country, but absolutely it is a challenging diagnosis. And so there's a couple of reasons, I think, and that filters into how it's diagnosed. So we know that some of the symptoms can be quite broad and vague, and we know there is not a lot of training that always happens at that kind of GP level for this condition, which is improving. But traditionally, it was poorly understood, this condition. So part of it is this misunderstanding of these symptoms and what they could mean. The second thing with that is the challenges around diagnosis that to be formally diagnosed with endometriosis, you often will require a laparoscopic surgery. So that you can have a transvaginal ultrasound, which is an internal ultrasound. However, that will not pick up all endometriosis. Realistically, that might pick up deep infiltrating, and that requires a really skilled sonographer. So that they are obviously, depending on where you live in Australia, there wasn't always a lot of them around. And so then the laparoscopic surgery obviously is invasive, that for some people, they can't find a surgeon that is skilled in this area, because that's also important. They need to know about this condition and be skilled to surgically operate on it. And they might live rurally. They might not be able to fund a surgery. They may sit on a wait list in a public system versus being able to see a private surgeon. Or they might be their surgeon. We see a lot of people, and this came out in a recent study about being dismissed. So, or being misdiagnosed with things like irritable bowel syndrome, a whole host of other symptoms that kind of don't require this laparoscopic surgery. So yes, to diagnose endo, laparoscopic surgery is still the gold standard. There is movement towards a clinical diagnosis where people are saying, we've got a high suspicion that you have endometriosis, particularly for that teenage population, if they're not being operated on young, is that we think you've got endometriosis. And there is a lot of research in the diagnostic space around blood markers, protein markers, genetic markers, because genetics-wise, you're 7 times more likely to have endometriosis if you have a direct relative with it.
Oh.
Yeah, so you'll see often it will travel down in family lines sometimes. So they might say, do you know what? My grandmother had really heavy, painful periods, but didn't know anything about it. Or my mum had a condition, had endometriosis, or my sister's got endometriosis. So you are 7 times more likely to. And that also fits into that kind of clinical diagnosis picture, I guess.
Yeah.
Yeah. Complicated, but laparoscopic surgery is essentially the gold standard.
Yeah. And I've definitely had friends who have had to go through that, and then they get told like how bad it is or the stage. So is that common to stage them, stage 1 to stage 4?
Yeah, so they will be staged during surgery. So obviously the stages contributes to research in terms of understanding the condition better, where the endometriosis is located, and during surgery a good surgeon will remove that tissue and excise it. What the stage tells them, I suppose, is the disease severity, and they use that to I suppose the gynecologists use that to understand what treatment options might be useful, particularly from a fertility point of view, is understanding fertility-wise what might be useful. But I think often the treatment will follow symptom management. That if you think that, you might have, I've had many patients who say, I've got a spot of endo, but I've got severe symptoms. Or I've had some patients come in and say it's everywhere, but I don't have many symptoms. So it's very, very difficult with the staging to understand that mentally, I think.
Yeah. And I think this is why it might even be such a hard discussion to have, because the number of variables, it's very hard to educate people in the community on these things when there are just so many different combinations.
Absolutely. And I think saying that you've got stage 1 endometriosis or mild endometriosis, and to someone who doesn't understand this disease, might make them think that this is not a significant problem. But we know this is for those that understand the disease will recognize that there's not that marriage of symptoms and disease severity.
Yes. Yeah, and that's a really important
Yeah.
part. Okay, that was really helpful. Thank you. And I've got two more questions for you
Yes.
around treatment options and then advocating for yourself within
Yep.
the medical setting. I would like to encourage people in the Q&A box, if you would like to ask a question about something we haven't touched upon yet, please go in and put your question there, and we can come to them straight after these questions because we're here for you. We want to make sure that
Yes.
you're getting the information you want. Now, talking about the treatment options for endometriosis. So, in regards to Zia as a brand, we
Mm.
have natural products, but we're very much of the belief that anything for treatment is of a holistic nature. So we are just wanting individuals to be able to access great medical advice, care, support, psychosocial needs, everything
Yeah.
when it comes to their treatment. There are obviously medical based ways to treat endo, and
Absolutely. Yeah.
then supporting that treatment with um, creams and
Yep.
lotion and heat packs and
Yep.
oils and diet and lifestyle. And so this question is going to be like, how long is a piece of string? But
I love this.
I know you'll be able to answer this so well. But what are the treatment options available? And I mean, can you talk about effectiveness and side effects?
Yes, I can talk a little bit about that. So, with a little bits within my wheelhouse. So, I suppose I am a pelvic physio by background. So, I live in the land of holistic care. So,
Yeah.
holistic care being care for the whole person, and Matilda's really centered around that. So, when I explain endometriosis care, the way I explain it is there's three pillars of care. And this is really like many chronic diseases that it works like this, where you have surgical care, medical care, holistic care. So, surgical care for endometriosis involves excision of the endometriosis lesions where they actually cut it out. It's a controversial space. I think if there's probably lots of endo warriors in this chat, so it's a controversial space because it's important that you find a surgeon who's done the training or has the skill set to manage this disease because it can present in many ways and it can look very different. And so you want someone that I suppose does a lot of surgery to understand this condition. But the goal is to excise this surgery to remove it as much as possible. And then I would say then under medical therapy comes under the realm of hormonal therapy. So being able to manage that cycle hormonally. What most doctors will utilize for that is to use progesterone. It's the general kind of management, although there are some that use combined pills and things like that, or intrauterine devices. That's more under the gynecologist care who will guide that. And they have a lot of experience, obviously, in working out what is the best treatment option for them. For the patient, what I would say is obviously you then see, and almost all people with endo do report this to some degrees. There are lots of side effects with hormonal therapy. And I think we can see
Mm,
that. We see that when people that don't have endo, it across the board is that, there are side effects with that. We talk about it, also under that medical therapy is other pain relief, more formal pain relief, I suppose. That often comes under the wheelhouse of the pain specialist team, who look at often having an escalation plan so that if they're having significant pain flares, how do they go up before they have to present to emergency? Because in the last 10 years, emergency admissions has doubled for endometriosis and pelvic pain. And so looking at actually how can we better support these people to not have to present to emergency in a safe way in the community.
mm.
And then under holistic care, the land where I feel very comfortable talking, it's where you see all your things that help and support the medical and surgical care. So that being things like physios, dietitians, psychologists, exercise physiologists, naturopaths, using things like creams and oils, heat packs, TENS units, and everything that sits around the person that is, I suppose, complementary to their care. So that's using things like acupuncture, that can really help. So what we see the value in that is that, so from a physio point of view, we obviously treat the muscles around the pelvis, so the pelvic floor muscles, which are notoriously hold a lot of tension in someone that has endometriosis. And we look at the whole body, so the nervous system. So really understanding that when someone is in a lot of pain, their nervous system is really upregulated. So how can we support that? And I say to every person I see with endometriosis is that realistically, if you've been in pain ongoingly for a prolonged period of your life, your nervous system is scared, and that's okay. That's really actually very normal. We need to help you to calm that nervous system, or we need to provide you with some tools to calm that nervous system, because a nervous system that is scared will actually help and produce more pain versus a nervous system that is happy. And then we look at people like dietitians. So low inflammatory diets are very popular with people with endo. And that's not a restrictive diet. That's a diet that's been tailored to you where you make minor adjustments. Naturopaths, we know that supplements help. We know that actually finding the right supplement, I suppose, portfolio for you versus taking 101. We know that heat packs help. You'll see every endo warrior will have a heat pack, a wearable heat pack. And we know that things like TENS units help with periods. And we know that exercise helps. There's good research. Everyone always cringes when I say that. And I always think to myself when I bring that up in a webinar and people think, I can't exercise. And I agree. I think it's really hard. So the realm for us is actually, what can you do? Can you walk to the letterbox? Can you walk around the block? So at Matilda, we really focus on movement. How can you move your body in a way that feels good for you? Because any movement is good movement.
Yeah. Okay. I'm just going to be like really blunt. That
Love it.
sounds like a lot of work and very
Yeah.
expensive. And I think this is the thing that people don't realize about a chronic condition, no matter whether it's endo or if it's something else, the burden it puts
Yeah.
on the person and their loved ones. But as an individual, feeling like, wow, I have to carry this mental load and prepare myself within my cycle, which is every month. Like for me, it's every 28 days. I have like one good week of a month. I like
Yeah.
it is, it's a lot. And I feel like, I mean, we
A
definitely
lot.
need,
It's a lot.
yeah.
I think a common statement I hear is I have appointment fatigue. I'm tired
Mm,
of going to appointments. I'm tired of every appointment. If I experience any medical trauma of being, people
mhm,
not believing me or having to advocate for myself time and time again. And I think, that's the absolute kind of soul of Matilda, is that really we believe that care is not affordable or accessible the way we are currently doing things. And that's
mm,
across the board. But holistic care is where we're trying to change, to kind of say, what can we do at this level, in this pillar, to make it more affordable and accessible? Because agreed, when I often present at conferences and things like that, I'll stand up and say, hey, imagine if you've got the worst pain of your life, you get it every month. There's a solution out there, but you can't afford it or you can't access it, or there's something that could help you out there. And so it's frustrating for the individual that,
yeah,
to see a pelvic health physio for an initial consult for an hour is $220. And often what people get back is $40 on their private health, if they have
yeah,
private health. So I think it's frustrating. It's a full-time job to manage a chronic disease, and particularly a
mhm,
chronic disease that's not well understood. So absolutely, I think that is a big problem in endometriosis care.
yeah. And also to so just for context, like my background, I've worked in aged care, or my family
Mm,
nurses. I've worked in aged care. I've worked a lot in community services.
yeah,
I managed a cancer charity for young adults and their psychosocial needs.
yeah,
It's with these chronic conditions, it's exactly what we're talking about in this conversation. Like the burden can be very overwhelming, and just the cost alone. Yes, we have Medicare, but how much does that actually cover? And for somebody who has to live with this
yeah.
for a very long period of time, it all adds up. And your energy is finite, it's not an endless resource.
No.
And finding that support is so, so key, so that in the times when you feel like you can't do it anymore, like you're tired, you're burnt out, you have someone that you can go to, and whether that's Matilda,
Yeah.
whether that's Zia, whether that's an endo community,
Yeah.
just being able to lean on that network and say, I'm having a bad day, that psychosocial support and that pillar of holistic health is
Yeah.
so, so important, because um, I love how you put it into pillars. We have
Yeah.
the surgical, the
Very
medical, and the
organized.
holistic,
Yeah.
but it makes sense. It's like, okay, which buckets do you need to fill? And how
Yeah.
can we fill that in a way that suits you and your lifestyle and the things that you've got going on in your life?
100%. And which buckets do they want to fill? So I think everyone will try the surgery pathway, and that's okay. I think we need surgery is still diagnostic. A good surgery will excise a lot of tissue if there's tissue there. And so I think we really see ourselves, and we've got a great clinical advisory group of 3 very well-known surgeons, and we sit alongside them because they know that what they do does not solve the problem, or there wouldn't be a problem anymore. And so they will openly admit and say, do you know what? We're just one part of this puzzle. And actually, everyone needs to do their role to help people. And if we all do our role well in a way that is as accessible and affordable as possible, these people can have a great quality of life and thrive. So kind of shifting that mindset of everyone kind of being in their lane and just doing their things into kind of thinking, hey, as a team, a person sits at the middle of this care. How can we actually work around that?
Yeah, amazing. So my last question for
Yeah.
you is really around how we can advocate for ourselves, because this is a really big it's a really big issue for any
Mm.
kind of condition, even if it's a one-off, long-term,
Yes.
being able to advocate for yourself in the medical system. We're not taught how to do that in schools. A lot of the
Yes.
time, when somebody like a doctor is telling you something, you go, okay, I'm not going to question that because
Yes.
they know more than I do. And when it comes to you and your body, we should feel empowered to be able to go in there and say,
Yeah.
okay, that's great. I might get a second opinion, or I need to look at that before I make a decision. So, in terms of advocacy, when seeking a diagnosis or when seeking treatment, especially if they're feeling like their symptoms aren't being taken seriously, what are the things that people can do to advocate for themselves?
Yeah, so absolutely. And I think this is something that the community do a lot of, is they have to self-advocate a lot. And I think particularly when you have a diagnostic journey that long, that comes with a fight. And it shouldn't be like that, but it is unfortunately a bit like that still. So things we're trying to kind of work on at Matilda, and things I really believe in, are language. So understanding the language used in the medical system. So, which is frustrating because you shouldn't have to. You should be able to just tell your symptoms, but actually the language used and understanding what that means. So, kind of having language around pain with sex and actually knowing that's not normal, having language around what's happening with your period. So, understanding kind of different parts of your cycle and understanding a bit more about the science behind that. So, we try facilitate that at Matilda, giving people language to what they're feeling. So another example I can give of that is that we had a lovely we call them Tilly Tribe members. So a Tilly Tribe member who said, I had all these bladder symptoms and I actually had no idea because I just actually just never thought of it. And until she took part in Matilda and learned about the bladder and the symptoms of endo associated with the bladder, she said it gave me language to go to my doctor and say, hey, I've got these things that are happening. And it happens, when I sit down the toilet, I'm really hesitant to start. When I'm doing a wee, it's very stop, start, flow. I don't feel completely empty. And these language of symptoms that she kind of thought, I've been feeling this for 10 years. And I didn't realize it was a problem until I could discuss it with someone with some understanding of normal. So I think that's one thing, is language. The second thing, I read a really good quote, was, it's not in my head, it's in my data. So I really like that. And you'll see this is a big trend in health at the moment with the Aura Ring and the Apple Watch. Everyone's
Mhm.
got tracking their life or their data, everything. My co-founder Kev is obsessed with tracking his data. So I know I always have a laugh because I'm absolutely not. I don't need to know how much I'm not sleeping. So so
Same.
yeah, it's best left unsaid. But I have to say that is like we have a tracking feature that's about to launch in Matilda in the next couple of weeks because that was something that's been heavily requested and heavily I suppose utilized is that people use period trackers, but some people
Mm.
with endo don't have periods because of whatever medical therapy they're on, or their problems not with their period, their problems with 101
Mhm.
other things. And so what we want to offer is that whole tracking service where you can go to your doctor and say, hey, I can tell you what I'm experiencing, but I can also actually show you and I can share this with you. I'm going to, in the future, hopefully send you a PDF off Matilda and say, hey, take a look at my couple of months because this isn't normal. And you can see in a quantitative way what's happening. So I think
Mm.
tracking is really important and don't track, it's very overwhelming to track everything. Pick your top bother, track one thing at a time, track your top two bothers to see if they relate to each other. I always say if you're going to track your lifestyle, track your sleep in terms of like really easy, good or bad. Was it okay? Track your nutrition, same thing. Was it good, okay, or bad? And then track your movement. Did you move or did you not? So you can keep it doesn't need to be fancy. You can keep it simple. So those are my things for advocacy. And then I would also say a support network. So one
Mm.
of the key things that we have heard in our customer interviews is I feel alone and isolated on this journey. And I know there's Facebook groups out there which can sometimes be challenging to navigate. So some people thrive in those and some of them don't.
Mhm.
But find your tribe. So whether that be, and this also kills my soul a little bit, but we see a lot on Instagram that there are some really great advocates out there at the moment. It's becoming, I heard one the other day that talked about being an endo influencer. So being able to find good quality, and does make it up, but find good quality people that you can learn from, and whether that
Mm.
be through Facebook, through Instagram, through, I suppose, people that are local around you, or people ask people, ask your health professionals, who can I talk to? Find my tribe for me.
Yeah. I mean, it makes sense to have like the endo influencer, but
Yeah.
it makes me
Same.
go like, oh, and the fact that we have to label it that, and you
Yeah.
have to find that lighthouse, you have to
Yeah.
search
Or
for it.
that they have to advocate, that they
Mm.
have to spend their time advocating. Like, I would say they're tired. They're tired of sharing
Yeah.
their chronic disease on a very public platform. But for anything to change, there needs to be a lot of loud voices. So I think from their point of view, a lot of loud voices make change.
Yeah.
And so that's what I think the drive behind that is. But find people, don't take it as gospel, whatever they say, but I think take it as, that's just a data point of information for me that might help me for where I am at the moment.
Mm. Yeah, I love that. And also like gathering that qualitative data.
Yeah.
And it doesn't have to be complicated, but
No.
being able to like see recurring patterns or where the
Yeah.
flare-ups are to take to your doctor. Because I find when I go to the doctor, if I don't have notes, I'm
Yes.
like, I walk out going, oh, I forgot to say this. I didn't talk about that.
100
Like, I get very overwhelmed.
100%. And I think going in there I always say, because my GP friends would kill me if I say go in there with your long list. They're all like, Joe, it's like a 5-minute appointment, which also is not okay. But
I'll
I
book a
would
long
say
appointment, thank you.
book a long appointment. That's just another cost. I say to the GPs, it's just another cost to the endo patient. Um, we have lots of fun debates. So I would say go in there with always have 3 things you want to talk about, and then I'll be putting my little questions off to the side. The other thing, I mean, on Matilda, we've heard that time and time again. I leave my appointment and I think of everything else I want to ask. So we on our next release in a couple of weeks have an Ask a Clinician bucket. So a
Mhm.
button. So you can pop your question into, we've got a list of clinicians, whether it be a gynecologist, a GP, a pain specialist, a physio, and you might and it won't be medical advice, but it will be generic information. So it might even be as simple as things like, how long till I can exercise after my surgery, and the gynecologist might be able to give a few ideas about, it might be 2 weeks if your surgeon has given you all clear, or if you feel like X, Y, and Z. Or I get lots of questions of things like, is it normal to have pain after sex? And the answer is no, it's not normal. It could be happening because of X, Y, and Z reason. Best to get it checked with your GP, or these are some things you can also try.
Yeah. Amazing. Oh, that's a really good feature. I love that.
Everyone's favorite feature, right? Yeah.
Yeah. I'll just pull my phone out of my pocket and like
Yeah.
boop, boop, boop,
I've got
boop.
lots of questions. I know. I can imagine it releases in a couple of weeks. It's going to be a hot feature, I feel.
You're going to be inundated.
I
Just,
know.
yeah.
That's a good place to be. It's a good place to be, right? Inundated.
It is. And the more people are informed, yeah.
Absolutely.
So that concludes my official part of this. Thank you so much for sharing those answers. That's really given a really great understanding of endometriosis as a whole. And we've got some Q&As here if you're ready. Now, can you see them on your...
Yeah, I think the first one's for you, probably.
Okay, so Anonymous has written, which Zia products can we use to assist with endo pain? Is Zia safe to use while trying to conceive and or pregnant? So I can absolutely answer that. In regards to endometriosis pain, our products are based on anti-inflammatory formulations. So first and foremost, where there's inflammation, our products can assist with that. We're working on a women's blend at the moment, specifically for premenstrual symptoms and any inflammation. I say the 3 Bs: breast, belly, back.
Love it. Love it.
But my favorite and what I use is the Cumsia concentrated massage oil, because it's an oil. It gives that beautiful soft silk feeling. It feels really nice to rub in. And then we also have our Cumsia Pain Relief Cream. So this is our hero product, and this is the one that has an ARTG listing for muscles, joints, and nerve pain. If you want to go talk to your doctor first about it, please do. That's what we encourage. And for anybody who would like to know the formulation, or if they've got any questions about our products, please just go straight to hello@zia.com.au. We've got naturopaths, we've got access to our formulators, and we can give you as much information as you need to feel good about choosing a product that's right for you.
The oil sounds lovely. I imagine on an endo belly, that would be really lovely
It's
to massage.
amazing.
Yeah.
My worst pain is my what do you call it when my ovulation pain?
There's a question about this coming down. So
Oh, okay.
I know. Question 2 is, how come I'm still struggling with this painful disease even after a partial hysterectomy 10 years ago? So this is a tough question for me to answer in a webinar. So there's multiple factors, but what I would say is a hysterectomy is not a cure for endometriosis. So, and this is what is really hard, because sometimes in the media, this is portrayed or thought of as a cure, but actually, because the tissue grows outside of the uterus, if you take the uterus away, it actually doesn't do anything to your endometriosis, except if you characteristically have heavy periods, it will obviously stop the period. It may not stop the pain during a period. So this is, I suppose, a really common misconception, is that if you have a hysterectomy, it will resolve it. If you have adenomyosis, which is where similar tissue to the endometrium goes inside the uterine lining, it will cure that. So I think that could be potentially why is that the hysterectomy won't cure it. Can endo reduce/disappear over time and then reappear later on? I wouldn't say that unless it's been surgically excised, it can reduce or disappear. Can it become less painful? Yes, I would like to think so, because then some things are working or you're doing your job. I wouldn't say that it can disappear. I mean, it's very subjective, isn't it? I mean, what might be seen on one ultrasound might not be seen on the next ultrasound, or depending if you've had different surgeons, things like that can obviously influence what is seen at that given time. Can it grow back? Yes, it can grow back. Is it that it's excised? And, it's very hard because sometimes endo, and one of our gynecologist on our panel that kind of leads our panel is Dr. Jade Acton. She's done her advanced scope training, and she talks a lot about, sometimes a lesion can present quite clear. And if you're not a very skilled surgeon, that's very hard to make sure you've got it all. So that can also be challenging. That has it regrown, or did you not see it the first time? And surgeons are human as part of this story as well. So, it is some of that will be surgical skill. All right, next one. I hear the rule of thumb is during a period that the pain levels can be higher. How common is it to experience pain during ovulation? I've been brushed off because of this. Yet I've had the lap surgery for diagnosis. So I would say it's common to experience pain in ovulation. Not everyone will get it, but a lot. And some people will say that their ovulation pain is worse than their period pain, 100%. I would say there is no right or wrong answer there. Is that there's no rhyme or reason to that. But I would say there are different hormones at different times of the cycle, and ovulation can be very painful, particularly if you imagine that you've got an endometrioma, which is like a little chocolate kind of cyst on your ovary, which some people with endometriosis do, or if you have endometriosis on your fallopian tubes. So you imagine that's when that egg's released from the ovary and travels down the fallopian tube. That can be painful for people. So absolutely, I would say you should not be brushed off because you have ovulation pain. It's what you do about it at that time that can be challenging.
Yeah, absolutely. And that ties back into the language,
Yeah,
understanding the different symptoms, and then being able to, if this doctor, this GP, if somebody is not right for you, seeking somebody who will
yeah,
be able to help you, because nothing should be brushed off, especially if it's consistent.
absolutely.
Yeah.
And remember, knowledge is power. That if you know that if every month you get pain around this point in time, utilizing treatment options the week before that, so that you kind of think, do you know what, I've got a trial and error, and this is deeply unfortunate how this works because it is a trial and error process, but each month thinking, I'm going to start doing things the week before ovulation to see if I can help improve this symptom, and tracking how that goes each month, so that then you learn from each month, which is unfortunate. There should be more guidance on that, but absolutely, I would say, yeah, if you can understand, knowledge can be power.
Yeah, love that.
All right.
Tina.
Yeah, Tina,
Oh.
osteo here. I have a love of osteos. Where do you think osteo fits in the holistic care part of treatment, and what do you think you could? So I had my first encounter with an osteo when with my second child, and I feel like osteo should run the world, is after how I felt after that. Um, so 100%, I think there is a role for osteos in holistic care. I have to say, in Perth, osteos don't have a big presence as much as I hear there is over east. So I think what the role of I would love to hear, and I would love to hear even from you, Tina, after this, via email. You can email us if you want. Where you think you fit and where you think you actually integrate, because I'm an open book when it comes to that. If what can you offer someone with endo? So I obviously spent many hours at the osteo with my child, asking her about endometriosis and how she fixes it, not about my child's problem. So I wanted to understand what they could offer. And they talked a lot about actually the whole body, the link of tension throughout the whole body, and doing those small movements to actually change that. And with really good relief, and a lot about congestion through the pelvis. And all I can say is I don't think I know enough about where they fit, but I'm really, really keen to know, because I think they are a really key part of this puzzle, and definitely in Perth and not accessed enough.
Mm. And I love that question at the end. What do you think we could do to help? I mean, Tina,
Tina, I love
yes,
that. And
power to you.
yeah, and I would
Uh,
love to hear more about that, because I do think that 100% is a role.
yeah,
All right.
lovely.
I've been seeing a
So
gyno
I was
dietitian.
just going to
Yeah.
say, Sorry, Joe. Mariska's got a few here. So I think
Yes, I
Mariska,
might combine it.
even if you scroll down, yeah, there's one.
Yeah.
So I think Mariska will answer all of
Oh, yeah, and
yours
will be
at once.
my ovaries to stop the pain. Yeah, okay.
Yeah.
So I would say, firstly, I'm really sorry to hear that, Mariska. That I think that that's actually really, really, really hard. And I wish I could tell you that I had exactly an answer to that because it's I wish that these stories didn't always affect me as much, but they do. They still, I think we hear lots and lots of traumatic endo stories, and I think they are awful. It impacts every facet of your life. So I would say you've got lots of people on your team, which I wish I could say we're also helping. So the other thing I would say is, are they the right fit for you? Have they done the right training? Which I don't want to absolutely dampen on them at all because I'm sure many of them have, and I wouldn't want to comment on that. But that would be the first thing I would just be thinking is how much experience they have in the endo space, and your gynecologist's kind of experience in that space. But and then I would be looking at kind of, yeah, that holistic space that you've had a few surgeries, and we know that repeated surgeries cause more scar tissue, which makes it more complicated to treat, which is unfortunate because I see here you've wrote that you're 43, and we know that actually that kind of, there was a lot of surgeries that probably used to happen a lot more commonly than they do now, this repeated surgery scenario, and that can be complicated. So I see here that you're thinking of getting your ovaries removed. Obviously, there's the complicated factor of that of menopause, 43, perimenopause. So that's all a very good discussion to have with your gynecologist about, is that actually going to help? And I couldn't answer that in your case. I think without personally actually treating you one-to-one, I probably couldn't comment on that. But yes, bladder and bowel surgery is very complicated disease and sounds like a very complicated journey. So I think all I can probably say is that I'm really sorry that that's happened to you.
Mm. And I echo that, Mariska. Like, obviously, we're so sympathetic and empathetic to what you're going through. It's really difficult, anything to do with your health, let alone these things that feel like it's endless. And it sounds
Absolutely.
like you are, feeling very tired, and you use the word struggle.
And you've got there
I
that you're now
just,
in Albany. Albany has, and yeah, so absolutely. So you're a WA based then as well, which is great. So Albany does have an endo clinic, and there's a great women's health physio down there. So absolutely, always happy to have a chat. Yeah, and see if there's people that I could recommend to you to see down there. But yes, Albany is one of the clinics for endo, which is great.
and good luck on your journey. And I hope and I know that with Joe and after this conversation, you'll have some more options for support. Um,
Yeah.
so yeah.
Absolutely. So Libby's asked, does being vegetarian or having low iron impact period pain? Um, I don't know if I could comment on that directly. Does being vegetarian, I would say low iron's going to definitely impact your fatigue. That's well, really commonly documented. I wouldn't know. I think that's probably something to discuss with your GP. We commonly see people with endo have low iron because they often have heavy periods. So I'm not sure if there is actually any documented evidence on that. Something I could probably do a deep dive on or having a look around. But otherwise, great question for your GP. I like to live in the land of in optimizing everything that we can control, because
Mhm.
it obviously keeping our body at a really happy, nourished, full cup kind of scenario is good for everything. So that being things like everything a bit balanced, including your iron. I don't necessarily have a problem with vegetarian. I think we've got a dietitian on our clinical advisory group who talks a lot about making sure that you've got. She actually does quite a bit of content on her Instagram. So her name's Christy Lee Nutrition. She does a lot about talking about the benefits of omegas, and I think her legumes are like her favorite thing to recommend. So that's vegetarian. She yeah, talks a lot about actually adding them in. So I think that is not a problem necessarily, but something that a dietitian could definitely help with or answer.
And Libby's just got another question
Oh, yeah.
under
And
there.
is it normal to have much more pain when the period is lighter compared to when it's heavier? Um, I probably couldn't tell you the answer to that as well. I would say pain is very challenging in the period space. So prostaglandins are what cause period cramping. Period cramping sheds the uterine lining. Is the period lighter because you're on a hormonal product, and that's why it's lighter? So that doesn't necessarily mean that it stops the pain. Is it hard? Often mentally, when it's lighter, we expect it to be less painful, which is oddly mentally challenging because all of us expect that. Is it a regular cycle? Is it a normal bleed for you compared to your actual period bleeds? And then I would say pain is a complex, we call it a physical and a mental experience because it is so complicated into everything that's going on. So is this that you've had a one-off lighter period, or is it that this is a trend for you? So that also factors in, I suppose. These are hard questions to answer, aren't they? Isn't it? So Anonymous, how quickly can endo grow back? I had a laparoscopy. It hasn't been 2 months since surgery and I'm already back in pain. So I wish this wasn't this case. I would say we survey people post-surgery and we're yet to have an 100% hit rate on surgery being curing it. So, or stopping the pain. So some people we see get a lot of relief, say for a year. Some people we see get a lot of relief for 5 years. Some people get no relief. Some people it makes worse. And our gynecologist, Jade Acton, will talk about that. She'll say, do you know what? For a percentage of people, this surgery will not improve them and could make them worse. So, which is deeply stressful for that individual. So how quickly can it grow back? What I would say is at 2 months, and I'm sure Jade would probably say this actually as well, our gynecologist is, and the evidence would say this, is that it might not be the endo that's causing the pain, depending on how your surgery was done. So depending on who your surgeon was and how the surgery was done, it should not be the endo that's causing pain. It might be pelvic floor muscles, it might be your nervous system, or everything else that kind of sits around the pathology. If we knew that if it was purely a lesion problem, surgery would fix this problem because they would cut the lesion out. But it's not purely a lesion problem. And so I often, part of how Matilda was born is that Dr. Jade Acton used to send patients to me after surgery who weren't better. And I used to be like, why aren't you better? And why things need to be different? And that is part of that story, is that we need to understand that actually surgery is just one pillar, and that then you need to sit with other things to get that whole system to improve. All right, Jessica, in 1 out of approximately 10 menstrual periods I have to present to ED, generally given more yes. Are there pain medications strong enough that... So I would say you would benefit greatly from seeing a pain specialist. So my favorite thing on our social media, you'll see Anna all the time. She talks a lot about things that have helped her, and her escalation plan is one of them. So seeing a pain specialist, and I like to think of it like a pyramid. So you've got your like day-to-day stuff that you do, and that might be things like Zia. You got your day-to-day stuff in there down the bottom, and then as you go up the pyramid, the medication gets more and more, I suppose, intense, until you're getting to a level that the top layer of that pyramid you use so infrequently, but it's like your get out of jail free card. So I call it like it sits in the drawer, you're not using it regularly. Pelvic Pain Australia have a really great kind of section about medications, and in there are things like vaginal diazepam. So can you insert a suppository of diazepam into the vagina to stop your muscles spasming? Are there things like, because we know that actually things like morphine sometimes don't even work, that you'll go in, sometimes if you have this really high dose it will, but not always. And so they talk about having like layers of slow release pain medication to quick release pain medication and things like that. And there are roles for that. So I think to keep people out of ED and be able to manage. And I think the other thing that they provide are security blankets. That if you know in your drawer you've got something, that if something gets so bad, you've got something there for you that you can take. That's important, because otherwise it feels very isolating and scary to not know where to go. So I think that would be the answer to that question, is that a pain specialist who specializes in pelvic pain would be an absolute key member for your team. Tina, I will say here, I've treated someone with endo before. I tried a gentle massage, a whole body rocking. It did seem to help her. Yeah, absolutely. Love that. So I think what I would say to you, Tina, is keep trying different techniques. Like it's great to be a clinician and trying things to see what works, because that's all information is power. You can learn from that. And then yeah, I would love to have a chat about that, because I do think that is something that's useful. And then Bianca, so I've been a long-term migraine sufferer, and recently in the last week been diagnosed with endo after lap surgery. I'm interested. Yes, yes, yes. I think there is a link to migraines. Endo is often, you hear endo sufferers talk about all these other conditions they have. So we've done a few on our Instagram talking about POTS, so postural orthostatic tachycardia syndrome. I always get that wrong, but that one. Um, irritable bowel disease, Crohn's, celiac disease, migraines. There is a lot of, you'll hear these people talk about, I've got this condition, I've got that condition. Absolutely. I mean, people talk about hormonal migraines. I think about, do people with endo get more migraines because of hormones? Do people with endo get more migraines because they carry more tension? Do people with endo get more migraines because their nervous system is upregulated all the time? So I think there are many reasons why, but absolutely. Is there a link? And if that was your symptom, yeah, absolutely, potentially.
Wow, that was a rapid fire round.
Love it.
Jo,
Look at that.
that was amazing. And I mean, what a great variety of
Yeah,
questions, but also this is a topic that I think has no limits in terms of, the things that we could discuss. And so
yeah,
I do want to let people know and remind people that there are so many resources that Matilda Health can help you with and help point you in the right direction for. And if you need somewhere that you feel safe and that
yeah.
you're getting the right information, Matilda really is a wonderful place for you to go. I do want to say, Jo, thank you so much. You're obviously such a well of knowledge, and that's really helpful. And I think, the key things that stood out for me is really being able to be comfortable with the language around symptoms, the diagnosis, just understanding all those different words and terminology, um, understanding your body, the
Mhm.
patterns, what happens when you get flare-ups, the data data sounds so dry, but I
It
think that's
is,
such
isn't it?
a great point. Like if we can record it, like I record my cycle every month.
Yeah.
And it just helps because, especially when you've got brain fuzz and all of those things happening, you can look back and go, actually, that was what I recorded. That is what happened. That's
Mm,
always great to take with you to your doctor. And also, don't be afraid to advocate for yourself. And if you don't think you have the right tools, the right specialists, the right people on your team, and you need to seek other
mm.
opinions, you need a community, or you just need to find someone else who's going to help you on that journey, because chronic pain is a journey. Um, don't be afraid to go out there and go to the people that you trust, or go to places like Jo, at Matilda, who feel like a really soft place to land.
Yeah,
In
that's a lovely way of describing it.
Yeah, that's what I call people I trust. It's a soft place to land when you're feeling your most vulnerable,
Yes.
and knowing that they're doing the right thing by you. I think that's so important in healthcare. And that's all that we wish for people who work in these industries. That's all we wish for you. But we really appreciate all of your questions and your attendance. We do hope that this has helped. And, let's keep talking about it. Let's keep having these discussions so that, that 6 to 8 year
Yeah.
diagnosis,
Yeah.
hopefully that can get shorter, or at least we can help to learn and manage those symptoms and pick up on them
Yeah.
earlier on in life. But great work, Jo. Very,
Thank you so
very
much.
in awe of
Back to
everything you
you.
do.
And back to you as well. I think we're so lucky to have products like Zia.
Yeah. Thank you.
Right.
Well, thank you so much, everybody. And hopefully we'll talk to you again soon. But thank you and enjoy your evening. Bye, Joe.
Bye. Thank you.